Good morning, and thank you for joining us. Welcome back to our annual Louisiana Early Ed Month. My name is Dr. Libby Saunier, and I'm the Executive Director of the Louisiana Policy Institute for Children. I'm honored to welcome you all to our keynote address this morning. I'm also honored to recognize the title sponsor for Louisiana Early Ed Month 2024, Entergy. This event would not be possible without the generous support we have received from Entergy and all our support sponsors and donors. To kick us off, we have a message from Governor Jeff Landry, a leader who understands that education is the key to economic opportunity and that the pathway to prosperity must begin at the earliest stages of life. Thank you to Governor Landry for proclaiming February 2024 as Early Ed Month.
Hello, this is Governor Jeff Landry, and I'm excited to proclaim that February is going to be Early Education Month here in Louisiana. Because getting our children off to a great start with a quality education is so vital to keeping them here in Louisiana and attracting families to Louisiana. Sadly, Louisiana has been ranked 50th in education for a long time. So this month, we're going to work to start to lift Louisiana off the bottom. Join me in proclaiming February Early Education Month, and let's get to work.
Now we're excited for our keynote address this morning. As you enjoy today's address and the rest of this month's activities, we invite you to share your participation on social media using the hashtag LA Early Ed Month. At this time, it's my honor to introduce Ariel Hughes, owner and director of Cartel Preschool, as well as the 2024 Early Childhood Leader of the Year, who will kick us off today for today's event and introduce you to our esteemed keynote speaker.
Thank you, Dr. Saunier. I don't know about you, but I think that something as important as early childhood education deserves an entire month of programming, celebrations, and events. I'm honored to be a part of the Louisiana Early Ed Month. Early care and education is necessary for the future success of our state. It's imperative that we invest in our youngest learners and prepare every child in Louisiana for success when entering kindergarten. This goal is achievable here in Louisiana, and we can achieve it through the collaborative efforts of state agencies, families, quality early care and education providers, and communities. Louisiana students are just as capable as students anywhere in America when given the right tools to thrive. This is our job and our purpose here at Early Ed Month, to make sure children birth to age 4 are best positioned to achieve success in school and in life. Now, it is my pleasure to introduce today's keynote speaker, Dr. Cynthia Osborne. Dr. Osborne currently serves as the Professor for Early Childhood Education and Policy, as well as the Executive Director for the Prenatal-to-3 Policy Impact Center at Peabody College of Education and Human Development at Vanderbilt University. Her teaching and research interests focus on social policy, poverty and inequality, family and child well-being, and family demography. Without further ado, I'm proud to turn today's program over to Dr. Osborne.
Well, thank you so much, Ariel. And I'm so thrilled to be able to deliver this keynote address and be part of Louisiana's Early Ed Month. I don't know if Libby even knows this, but Louisiana is my home state. That's where I was born and where all my family are from. And so it's really special to be able to celebrate this important month about getting all of our children off to the right start so they can thrive throughout their life course. I have some slides I'm going to share with you over the next half hour or so to really walk you through what we know about how important the earliest years are for children's development, to celebrate some of the amazing progress that Louisiana has made over the last year and longer even, and to help provide information about what we know can really help all children thrive from the start. So, as was mentioned, I have the privilege of directing the Prenatal-to-3 Policy Impact Center at Vanderbilt University. And the whole purpose of our center, we exist to be a resource for states as they try to implement effective policies that help all children thrive from the start. We're a research-based university. We are nonpartisan, but we share everyone's goals of our children reaching their optimal potential. And so that's what we strive to do. And all of the work that we do is based on the science of the developing child. And many of you who are on this at this event probably are very familiar with this research. But it's clear that the earliest years of a child's life are the most rapid and sensitive period of development that really set the stage for lifelong health and well-being. And that we know if our children are exposed to safe and stable and nurturing environments in those earliest years, that they're really set on this trajectory for health and well-being across their life course. But also, if our children are exposed to chronic adversity in those earliest years, that can damage the developing brain and body systems that can also have lifelong negative consequences in terms of how they enter school, their performance in school and in the economy, their social relationships, and their health, both physical and mental. And we know that early education plays such a key role in helping to facilitate this important period of development, that this is a time in which our brain is expecting input, and that the most important input that we can provide are really through these nurturing relationships where the caregiver and the child are interacting in ways that really both stimulate the child's brain development and allow them to feel like they are the most important thing in the whole world and that they're loved completely. And that is really what leads to both healthy brain development and healthy body development over time, especially when we can reduce the stressors that our children are exposed to. But we didn't want to stop just there. What we wanted to say, if we know what it is that our children need in order to thrive from the start, then what are the policies that states can implement that help to create those conditions in which our children thrive? So as researchers, we turned to the evidence, and we looked at dozens of state level policies and reviewed thousands and thousands of documents and hundreds of the most rigorous studies that have been conducted to really identify what are those effective policies, those policies with a strong evidence base, that they make a difference in the things that matter for children in those earliest years. And there were four main takeaways that we had from all of this research that we did, and the research is ongoing. But first is that we have identified 12 policies and strategies that states can implement that empower parents and really support children's development right from the start. We also know that there is no policy or strategy that any state can implement that is just going to focus on the kids. That everything that we do has to be about also caring for the caregivers so that they can care for the children. That children do not exist in isolation. They exist within their family, within their community, within their child care centers, their early education, home visiting, whatever it might be, that our children are not isolated and that we have to think of them within this system. We also found that there's just no magic bullet. We can't just do childcare. We can't just do healthcare. That it really does require a system of support that includes a combination of broad-based economic and family supports, as well as more targeted interventions that meet children's specific needs in order to really create those environments in which our children are thriving. And not only did we identify what it is that works, we also looked across states to understand which states are implementing these effective policies and strategies and how they vary in terms of their generosity and reach. And what we found is that across the country, there's really a patchwork of benefits and supports for families. And where you live has such a key influence on the level of resources that a child has beginning in their earliest years. State policy choices really do matter. Well, we wanted to take a second to really recognize Louisiana, all the achievements that Louisiana has had in early education. And your ears are probably burning often because I talk about these wins that you've had to really demonstrate to other states that it's possible when folks work together, when your elected officials are really committed to children's early development, things happen. You are one of a very small number of states that has a dedicated funding source for early education. And that's so vital right now, especially as federal funding sources are starting to dry up. And so there are other states that are looking to you to try to emulate how you have set aside specific revenue to go toward early education. You also have one of the largest investments across the country dedicated to early education. And I know that this is something that's been one of the largest investments that Louisiana has made, but per capita, it's really off the charts. And it's something that you should be very proud of and going to make a huge difference. You also are doing some structural changes that others are looking to, and I'm very excited about, to understand how you're going to be able to link your data systems between our early education years and our K through 12 years so that we can really understand how our children's both cognitive and social development is evolving from birth to the time that they graduate high school. And that you're going to study how you may actually think about funding our early care and education in a similar way as K-12. And that those kind of thinking systematically like that is something that I hope that you recognize is not something happening in every state. And although I know there's more that you want to do, you've accomplished so much. So in our roadmap, I'll go through what our 12 policies and strategies are that I mentioned we've identified that have an impact, a positive impact on the earliest years. But one of them is child care subsidies. And our child care subsidies are something that we know both promote parents' ability to work, they make childcare more affordable, they allow parents to access the childcare that they actually prefer. And we've identified a key set of levers that states can really exercise in order to make it so that more families have access to a childcare subsidy, that it's more affordable even when they do, and that it helps both providers to provide enough, to have enough in resources so that they can pay their teachers and so forth. Again, there's always more to do, but Louisiana is one of 7 states that has met the benchmark that we have in these 3 different levers, and that's on both eligibility, your co-payments, and your overall reimbursement rates. And I'll go through those just briefly in turn. So one of the first things that states can do is determine who is eligible for a child care subsidy. And the federal government says that you can use state dollars to make families with incomes up to 85% of a state's median income, they could be eligible for a child care subsidy. And in fact, you're one of a small number of states that actually sets your eligibility level that high. There are several states that have exceeded that limit and use state dollars. But it's important, obviously, to balance who's eligible, which would increase demand, with also thinking about supply. And so that's something that I know that you as a state are considering. And I have to say that it's you actually can do a lot with your child care subsidies, because in our calculation, about 40% of those that would be of centers or facilities rather that would be eligible to receive a subsidy, about 40% actually do accept subsidies at some level. And compare that to your neighbor in Texas, which is under 10% that do this. So when more providers accept subsidies, subsidies can have a bigger influence on stabilizing the market. So beyond eligibility, another important thing that you are doing as a state and that we're looking at across the country is how states are considering families' contributions to childcare. And that can come in both what they're expected to pay as part of the reimbursement rate that providers can receive. So this is what we call the copay. As well as additional fees. So whether the families have to make up the difference between what the state will pay a provider and what the provider would charge to the non-subsidy receiving client. And the federal government has set a 7% threshold for affordability, meaning that families shouldn't pay more than 7% of their income in childcare subsidies. Or for childcare rather, and in Louisiana, you're just around 5.5%, which is one of the better states across the country. This graphic, even online, is too busy to see, but what I wanted to illustrate is how the market rate varies from state to state, and how states actually vary in terms of helping providers get enough money to cover that market rate. And so what the reimbursement rate is to providers. And in Louisiana, you have one of the kind of both higher market rates, but you also have one of the most generous reimbursement rates to providers, particularly among your states that are nearby. So you are more than double that of Arkansas and Mississippi, and quite substantially higher than Texas. But importantly, what you see is that all of your bar is blue, meaning that for the most part, the amount that the family would have to pay if they were a family of three making 150% of the federal poverty level is that they wouldn't have a copayment, and you are covering substantially more so that providers can use those dollars to provide higher quality care and pay teachers a higher rate is what we're hoping will happen. And I'm going to show you how all that combines here in a second to really help families meet their needs. But I wanted to just briefly go through what the 12 policies and strategies are. So childcare subsidies is really an important part of this system of care. But there's also several other policies that will help families allow to really meet their resources that they need and to help meet their children's needs. Louisiana is one of 40 states that has expanded Medicaid so that families up to 138% of the federal poverty level are eligible. I know that you have been considering a paid family leave program, but that is one of the most effective policies that really impact a host of outcomes, help both with bonding, it helps families return to work, increases their income, increases children's outcomes, reduces infant mortality, and so forth. Higher minimum wages make a big difference for families, not just in terms of their income, but also in terms of their health outcomes. They reduce child welfare. And earned income tax credits also play a big role in improving both families' economic resources, incentivizing more families to work, and improving health and other outcomes of well-being. And although you do have a 5% credit, the kind of where we start to see those impacts is when the credit reaches 10% of the federal credit. And then I'm not going to spend a lot of time on these strategies, but they are important to really try to meet some of the specific needs that families have. So they include making it so that families can actually access the benefits that they're eligible for by reducing administrative burden. And you do that for families who are eligible for SNAP by making it so that they can be certified for 12 months, that they only have to report changes in income that would affect their eligibility, and that they have an online case management system that will help them in the application and renewal processes. Another place that states are investing is in comprehensive screening and connection programs. These are Family Connects or Healthy Steps programs that allow families to be screened for the needs that they have specifically and connecting them to the programs that can best meet those needs. Group prenatal care, which is just like it sounds. You're one of few states that has an enhanced reimbursement rate. However, you don't currently offer any group prenatal care, as far as we know, in Louisiana. Our community-based doulas, our evidence-based home visiting programs, early Head Start programs, and early intervention or Part C programs, all of these have strong evidence that they make a difference in helping kids thrive from the start. All right, but how do all those programs and policies intersect to really make a difference in kids' lives? And what we wanted to do was to take a family, what we call a stylized family that we can compare across all states in DC, to really understand how state policy choices start to intersect to provide resources for families that we know are so important to both early brain and body development and lifelong health and well-being. And so we have chosen to look at Lena. She is a mom with an infant and a toddler. And Lena works full-time all year round, but she earns the state's minimum wage. Now, the minimum wage in Louisiana is $7.25 an hour, the federal wage. But if she kind of worked around the 10th percentile of all wages at the low end, it would be around $9 an hour. So we can think about that, but it's around $7.25 an hour. Now, she applies for and receives all the benefits that she's eligible for. So she gets a child care subsidy, she gets her SNAP and WIC, and she also files her tax returns, so she gets any tax credits that she has coming back to her. Because she has an infant, she just had a baby, she took 12 weeks of leave, which she's eligible for as part of the Federal Family Medical Leave Act. And in order to work, Lena leaves her children at in center-based care that charges that 75th percentile of the market rate, so that it's the price that it is set such that it's about, there's 75% of the market charges less than that. But this is what we call the equal access target that should be equating to higher quality. So that's Lena. And if we looked at that same mom across every state, this graphic, which again is too hard to see, at one kind of glance. But what this is showing is the distribution of resources, the variation rather in resources across the country. So if Lena lived in the District of Columbia, she would have over $47,000 in resources to provide for her children. And most of that's coming from her earnings. Some of that is coming from the additional tax credits and limiting the out-of-pocket childcare expenses. But if Lena lived in Georgia and engaged in the exact same behaviors, so she worked full-time, she sent her kids to childcare and so forth, she would have just over $20,000 in resources. Her income would be much lower, her out-of-pocket childcare expenses much higher, and with very few tax credits. In Louisiana, Louisiana ranks the 34th out of 51 in terms of resources that are available to Lena. And I want to show you kind of how that adds up. So when we start with wages, again, if she's just making the minimum wage, she is getting just over $15,000 a year in resources or in earnings. That would be about $18,000 a year for if she was earning the 10th percentile. But again, the state policy is that she would only earn just over $15,000 a year. Now, she has to take time off to care for her newborn child. And when she takes 12 weeks off, she would lose almost $3,500 in earnings. And because at this time, Louisiana doesn't have any paid leave, all of that is unpaid. So now Lena's earnings are just around $11,600 annually, even though she works full time. Now she sends her kids to childcare. And in Louisiana, if she were to pay for childcare without a subsidy, it would be about $14,000 a year for both of her children. So that would take all of her pay, and she would have to come up with another $2,400 to actually pay someone in order to work. So Lena's not going to work in that instance if she doesn't have a subsidy, where it is too expensive to afford any sort of childcare. But in Louisiana, the subsidy covers all of the cost of childcare. So she does get to protect all of those earnings at $11,600. Now, she applies for and receives the benefits that she's eligible for. If we start with just the federal benefits, she receives SNAP and WIC, and both an earned income tax credit as well as a child tax credit from the federal government. And all of that combined is around $18,000 in additional resources for Lena. And there is a small, like I said, 5% tax credit or earned income tax credit that she would get when she files her state tax credits or state income taxes. And so overall, Lena gets just under $30,000 a year to be able to provide for her child. And again, that is 34th. But there are things that could make a big difference, that if we had paid family leave or expanding the earned income tax credit or increasing the minimum wage, that all of those things would lead to substantially higher resources. And that higher resources for Lena mean that she can provide more stability for her family in terms of food and food security and housing stability, economic resources. It also reduces the stressors on Lena that allows her to engage in those nurturing parenting interactions that are so important for healthy development. So that's the reason why we want to look at how resources combine. And if you look at Louisiana compared to your neighboring state of Arkansas, there you can see that families in Arkansas actually would, Lena would have more resources, around $6,000 more, which is about $500 a month, to provide for her children. And that comes because Arkansas has a minimum wage that's $11 an hour. They do have to pay state income tax, but you can really see the difference in earnings that it makes when state minimum wages are increased. All right, in the interest of time and to make sure that there's enough time for Q&A, I'm going to just sum up really what I think is so important. The research is clear that if we can support children in their earliest stages of development, that we can set them on a trajectory for lifelong health and well-being. And we know that our state policy choices make a difference. They can reduce the stressors on families. They can help to increase the capacity or skills in households that allow families to engage in these nurturing relationships. And they have a substantial impact on health and well-being, both for the parents and the children, and it affects the child across the life course. And I really congratulate Louisiana on the important advances that it's made on childcare with regards to its subsidies and other sorts of areas. And I'm looking forward to see how Louisiana continues to expand to think about supporting early education, early childhood development across a system of support, with childcare being a very important component of that. We invite you to reach out to us, to follow us on both social media, to join our listserv if you're not part of that, so that you get our newsletters and updates and sharing of resources that we put out very regularly. And if you would indulge me to let me know kind of what you think about the information that we're sharing. This isn't just a Yelp survey. We don't ask you whether you like the presentation or not. What we ask is what information you find useful, how you'll use the information, and what information you would like to have, and if we can provide any additional information for you to help either educate you or to help you educate and inform others and to make important decisions for our children. So if you can click on this QR code, I think in the chat there's a link to the survey as well. I'm thinking that that's right. But we would really love it if you took just a second to do the survey. So with that, I am going to close out the slides and really looking forward to any questions that you might have. Thank you.
Thanks so much, Dr. Osborne, for joining us. I've seen you do versions of this. It was so nice to have the call out for Louisiana, what it looks like with the subsidies and the different supports that we're able to provide. I'm wondering from your perspective, what is one key policy change that any state, Louisiana obviously is the forefront of our mind, but any state could make to make a substantial difference in the lives of children and families?
It's always a big question. Again, we have a roadmap for a reason, because what we always start with is what are the goals that states have? And is it about early learning? Is it about better health or better mental health? Is it about more resources? We know that resources in families' lives are really foundational. And so whatever you can do to get more resources, to get families to be able to work and care for their children, that makes really foundational differences and the largest differences. Because sometimes when we offer additional programs like expanding home visiting or expanding early intervention, those are so important, but they often reach a smaller number of folks, and they're very targeted towards specific needs. And so when a family needs those services, they're excellent for them. But everyone needs food security, everyone needs housing stability, everyone needs income support. So that's the reason why we kind of combine those two. It's kind of like asking me if I have a favorite child. No, but there are some children that I would take with me to do some things, and others I would take with me to do something else. So that's a little bit of a tough question. You are considering paid leave. You've extended it to your state employees. That's such a big step forward. That would make a huge difference across a range of outcomes for children and their parents. And you already have an earned income tax credit that's doing a lot and could do more if it was slightly more generous too. So those are the policies. And then in your strategies, you have opportunities for expanding by tapping into some additional resources, like using Medicaid to fund home visiting, for instance. A lot of states are doing that, or thinking about these screenings that could help you to identify what the families actually need and connect them to those services. So there's some targeted areas that I think Louisiana is really ripe for, that we'll see where you go in the next year or so.
Yeah, I can't wait to see where we go in the next year or so, or the next 5. One of the areas that we really have spent a lot of time on is an initiative called Go Far Louisiana, which is really related to an early childhood system and its connectivity. So to your point about expanding home visiting, and what does that look like through Medicaid, but also if we think about what universally offered home visiting looks like in the state of Louisiana, that we have, potentially private pay to help support that program as well. And you mentioned something about expanding with the resources that we have. And I know at the end of the day, if we think about, what's the biggest barrier to doing what we need to do for children and families, it's always resources. Mm-hmm. What are, in your viewpoint of the world, what are some ways in which we can utilize resources that we currently have within the state differently to expand access to supports and services for young children and families?
That's a really great question. One, you do have dedicated funding, which is fabulous. It's a great place to start for your for kind of early education. I think tapping into Medicaid and really leveraging it as much as possible is another important resource. It is because you're an expansion state, a lot of that would be covered by the federal government. 90% of most of those resources would be covered by the federal government. So that's an area of where we see where states are trying to leverage. I think it's also states grapple with whether you provide a little bit to everyone or a lot to those who need it most. And that's a policy decision, and trying to really target your resources to those who we know would benefit the most from them is something that you may also try to consider, where you can really hone in and say, these are the areas of greatest need, or we can link our services. We know if our children are screened, but they don't need early intervention, but those are our ones for our home visiting programs. But that then they're the ones who also need to get into our early Head Start programs. So you know what I'm saying? Like that connectivity, I think also is a way of helping to be more efficient with the use of resources.
That makes sense. We have a question from Megan saying, how are you measuring impacts on lifelong health and well-being for kids and parents? Are there other indicators of family stressors you consider other than economic resources?
Yes. So two great questions that are related. When we think about lifelong health and well-being, we really think of both kind of the short and medium term, as well as a child adulthood and even gets older. And we're looking at social outcomes, so both kind of emotional health and relationships, kind of refraining from criminal activity, from being those who kind of are able to get married and stay in healthy relationships. Those sorts of things are linked to early adversity, as well as economic and educational outcomes. So including earnings and graduation and college matriculation and so forth. And the research is also clear that if we look at specific health outcomes later in life, that's very tied to early brain and body development, from cancer and heart disease and lung disease, kidney disease, and so forth. So we look across a range of indicators when we're really trying to define lifelong health and well-being. And when we think of stressors, there are a lot of things that lead to stress. So it can be a lack of resources and living in chronic poverty. It could be a lack of resources that lead to housing instability or food insecurity. It could be early trauma. It could be having parents with mental health issues. It could be experiencing violence. There's a range of kind of early chronic stressors that we know impact the ability to both make decisions, to interact with our children, that damage the developing brain and body. So we look across a range, but economic resources we know are really kind of foundational for families to be able to acquire those skills, to have the time, reducing the stress that they really want in order to do things like read with their child or sing songs and play games, or spend the time that they really want with their children. So we don't think that it's only money that matters. It's that's really kind of the basic building block, and reducing other forms of adversity that allows for these nurturing interactions with children.
Absolutely. It's just eye-opening when you start taking the pieces of the whole out to really understand how you support children and families to be not just thrive, but really to succeed in life. Kristen Brown just said, thank you so much for shedding light on this important topic for our future. Sonia Brown Joseph is asking, how do we really support families when so many people face implicit biases as well?
Well, I think that that's a really great and important question. One of the things that we focus on is looking at whether all children have access to the services that they are eligible for, that they need and that they are having the impact on all children that they need to have in order to see that our outcomes are reducing longstanding disparities. So it's a long way of saying, if you take things like birth outcomes, which are crucial for predicting both your health and your physical and mental health, your educational success, and so forth. The preterm birth, for instance, is one of the most predictive outcomes. But historically and today, women of color are more likely to give birth to babies at an earlier stage in gestation, and that babies that have lower birth weight. There's also big differences in the likelihood that the child will die in infancy, and that the mother would die in the postpartum or birthing period. These are long-standing trends that persist today. And what we've done is to look in the research and to see what are the policies that try to close some of those gaps. And interestingly, access to healthcare makes a really big difference. Our having access to paid leave, community-based doulas, minimum wage policies, earned income tax credit policies, these all help to improve birth outcomes. And there are ways in which they will help to really reduce those disparities in outcomes. So we have the evidence, but we need to learn more and more and more about how we can reduce disparities and make sure that all of our children are thriving. But it's a really important question and something that we pay a lot of attention to.
Thank goodness you do. And as we transform as a state, now that we have a doula registry, and we have, other policies in place to really support, safe and healthy birthing, I can't wait to see how we transcend on the roadmap over the next few years, and look forward to working with you and your team more. Thank you to Dr. Osborne, Ariel, as well as Governor Landry for joining us today for the keynote address. And thank you to everyone who took time out of your busy schedules to join us for today's program and subsequent discussions. We're looking forward to a month full of virtual programming in recognition of Early Ed Month. Throughout the month, we're co-hosting regional events for elected officials and business leaders with United Ways across Louisiana. You'll see that we have on Tuesday, February 20th at 6 p.m., we are inviting parents and guardians or anyone who wants to learn how to advocate for Louisiana's youngest learners to join us for Louisiana Early Education Month Parent Advocacy Training. And then on Wednesday, February 21st at 9 a.m., we invite you all back to join us and parents as we discuss our annual parent poll survey findings that focus on the child care arrangements of Louisiana families, including their needs and experiences related to childcare. And then on Thursday, February 22nd, we invite you to participate with us to celebrate Social Media Day of Action. We'll be sharing a social media toolkit with you of all following today's event so you can learn how to join us on the Social Media Day of Action. Also, I'd like to thank our additional Early Ed Month sponsors. Your endless support allows us to continue to advance policies to ensure that Louisiana's youngest children are ready not only for success in school, but also in life. For details on how to tune into this month's programming and to learn more about early education and childcare in Louisiana, please follow us on social media at Policy Institute LA or visit our website at policyinstitutela.org. Again, thank you for joining us today. Thank you to Dr. Osborne and to Ariel, and also to Governor Jeff Landry for declaring February 2024 as Early Ed Month.